But we begin with the report from Michigan's Auditor General that shows a discrepancy in the number of COVID deaths in long-term care facilities. Thank you so much for joining us for 7 Action News at 5. I'm Brian Abel. In a letter to State Representative Stephen Johnson, the Auditor General says it identified almost 2,400 more deaths linked to those facilities than previously counted by the state health department. The Whitmer administration disputing the methodology and conclusions of the Auditor General's report. 7 Action News reporter Kimberly Craig has been looking into this report. And Kim, does the Auditor General flat out dispute the number of deaths that the state health department reported?
And that's the thing, absolutely not. The Auditor General did not actually dispute the number that the State Department was reporting. They actually said that the state accurately reported the deaths. Now, the difference is the Auditor General is including, and was actually asked to include, facilities that the state does not count. And for example, both sides would agree that this nursing home here in Westland has had 60 COVID deaths, but the State Health Department would not count COVID deaths at, let's say, a small adult foster care facility.
These are long-term care facilities that were required under Governor Whitmer's policies to accept COVID-positive patients, and because of that, our most vulnerable residents were put at risk. That's something that never should have happened, and there needs to be accountability on this.
State Representative Stephen Johnson says the number of COVID deaths reported by the Office of the Auditor General tied to nursing homes and other long-term care facilities is proof that Governor Whitmer bungled the handling of the pandemic. From January 2020 to July 2021, the Auditor General linked 8,061 COVID deaths to long-term care facilities, much higher than the 5,675 reported by the Michigan Department of Health and Human Services. It's a difference of nearly 30%.
It is really concerning that people may be using an Auditor General's report that is clearly misleading, that had a question that was asked to clearly put out misinformation as the truth to the people of the state of Michigan.
I believe that the department is dead wrong in this, and it's actually shameful what they're trying to do. They're trying to deflect away from this. They're trying to confuse the people in Michigan instead of just taking accountability for their actions.
Much of the discrepancy in the number of deaths is in how a long-term care facility is defined. The Auditor General included deaths at adult foster care homes that had 12 or less beds. The state did not. And the health department claims the Auditor General used unreliable sources for his numbers. State Health Director Elizabeth Hertel said her office counted deaths in facilities licensed and regulated by the state.
The department was being very conveniently just saying, well, we're not going to look at these other facilities, even though everyone out there, if they looked at it, say, yeah, that's a nursing home.
It's a little frustrating when they're making up a definition of what they think long-term care is, and then including things in that definition that nobody else uses.
When they presented to us the number of deaths, they were conveniently leaving out a large block of facilities that should have been counted. And so when we asked the Auditor General to conduct a report, we wanted to look at all these facilities, because everyone's life matters.
This assertion that we are trying to hide something is really concerning to me, because we work really hard to make sure that we are getting accurate information out.
And we will have the full report from the Office of the Auditor General on our website at WXYZ.com. In Westland, Kimberly Craig, 7 Action News.
All right, Kim, thank you. And as Kim just mentioned, head to WXYZ.com to view that full report.